Welcome back, Chronics, and thanks for joining me. Today we're talking about some pot stuff, like mechanisms that drive hyperventilation in pots when we can't breathe. It reveals some very interesting things. The talk I watched was actually on the Dysautonomia International website, which also has great presentations by doctors. Dr. Jacquie Baker is from the University of Calgary, and she is in cardiac studies. She actually was interested in the root cause as to why our autonomic system just goes haywire. First, she says we should refer to it as the automatic nervous system opposed to the autonomic nervous system, because it basically just kind of goes on its own, unless you're us, of course. The nervous system regulates heartbeat, blood pressure, bowel, and bladder functions. So the first thing she was interested in was seeing how inhaling and exhaling affected the CO2 levels and the oxygen levels in patients with POTS opposed to normal people. As we continue to breathe deeper and deeper, we're blowing off more carbon dioxide, which can lead to hypocapnia or low CO2. So she saw when the patients started to hyperventilate, their CO2 levels dropped dramatically. So the study concluded that just from low CO2, that can worsen heart problems. Again, they were able to come across these findings using mice, which I still don't understand, because we have many rats here in Boston that do not have homes. And most say Boston is run by rats, so I don't understand why they're taking like Gus Gus from Cinderella. The test they could do on us humans was giving us oxygen to see how that affected everything. And it didn't go well. Whether they were lying down or in the 60-degree angle tilt table position, their ventilation went down, the amount of blood pumped out of their left ventricle went down, and their brain blood flow was decreased. In layman's terms, basically when the blood drains out of these specific areas of the brain, it's going to cause symptoms. Okay, so that's not new information, but this is. Because of this study, she thought that potentially reintroducing carbon dioxide back into our system could reverse these symptoms. Makes sense, right? Okay, so this treatment isn't yet available, but if you're watching this and you're thinking, oh, I've literally tried everything. Medications don't work, this doesn't work, that doesn't work. There are so many studies going on now and so much more information that we're getting about the root cause that treatments are going to be coming up very soon. Thank you, as always, for joining me, Chronics, and remember, stay strong, hang in there, and don't take crap from anyone. I will see you next time.